Tonight, health advocates and lawmakers are calling for South Carolina to expand Medicaid coverage. South Carolina is one of 10 states in the country that has chosen not to expand coverage to include all individuals below the federal poverty line. However, the governor remains staunchly against it. Our Josie Frost is at the State House with more on what happened today. Josie.
North Carolina lawmakers passed their own version of Medicaid expansion last year that they say cost the state nothing. Most of the funding came from the federal government, while the rest of it came from local hospital associations. Supporters of expanding Medicaid say our federal taxes are already paying for these programs in other states, and South Carolina is just sending our taxpayer dollars there.
I've lost my ability to walk, and I actually might have that ability back if I could have that back surgery.
When Cliff Arnold got sick, MUSC had the treatment he needed, but he couldn't afford it because he didn't have insurance. Under Medicaid expansion, all adults earning less than $20,000, regardless of whether they have any dependents, would qualify for coverage. Senator Tom Davis proposed a budget proviso which would have created a committee to study health care reforms, including the possibility of Medicaid expansion. He says he's not sure how long Medicaid would be sustainable, but thinks lawmakers should at least discuss it.
And we're talking about something that is 90% paid for by the federal government. And the fact that we don't accept that money doesn't mean that we're saving any money on the debt or the deficit at the federal level. That money just gets allocated to other states. And so we're leaving on the table $1 billion, at least $1 billion every year that could be going into healthcare services in South Carolina.
Governor McMaster vetoed Davis's proviso. He said today he'd rather spend money on helping the uninsured find jobs.
I would rather put money into that than putting money into something for childless, able-bodied adults. We have jobs for them.
But for people like Arnold, he says having Medicaid would actually help him go back to work.
It would actually put food in our refrigerator.
The North Carolina version of the Medicaid expansion bill passed in a Republican-controlled legislature, similar to our own General Assembly. Senator Davis says he believes the Health Care Study Committee should be discussed again when the budget debate rolls back around. Reporting at the State House, Josie Frost, News 19, WLTX.